Good afternoon. The next keynote is going to be given by Stephen Adler. Stephen Adler is an information strategist. I understand information strategy to develop mechanisms and strategies so that the right information reaches to the right people at the right time. Something that is very much related to epidemics, to our preparedness to epidemics, and to our response and reaction to epidemics. Stephen Adler is, as I said, an information strategist at IBM. He's an expert in data science, data governance, and enterprise privacy architecture, among others. Stephen Adler advises governments, city-states, large NGOs on open government data standards, privacy issues, and he's one of the first people to develop the internet insurance a long time ago. Stephen Adler is recognized as one of the top 100 most influential people in finance by Treasury and Risk magazine. He tells me that this was already 7 years ago, so he must have been now in one of the 20 or 30 most influential people in finance. Stephen Adler is going to address with the title, Effective Technology Applications for Infectious Disease Threats, Mapping Health Care Services and Equipment Using Data Systems. I call upon Stephen Adler.
How are we doing? Good. I'm going to talk for 15 minutes, and maybe we can talk together for 15 minutes. At the end of the day, you guys have been listening to stuff all day, and you probably want to be somewhere else other than listening to me right now. So I'll try to be as brief as I can. Oh, there we are. Good. Do I have a flipper? Good. I'm Steve Adler. I work at IBM. And you're probably wondering why I'm here. I've been wondering that myself for the last 2 days in many ways, but I've really, really enjoyed the last 2 days. I've learned so much from all of you. I came to aid development, Ebola, almost by accident. And what I wanted to tell you is a little bit of a story about my experience working in the Ebola crisis as an outsider to the development community, as an outsider to international aid, as a technologist, as a businessman, as a process person, as a data guy. And I hope that I can shed some light on your question, Larry, about how we can prevent or how we can prepare for future crises. Because I learned a lot about our incredibly appalling lack of preparation for the Ebola crisis. That's what I really saw up front, firsthand, working with one country specifically. And it started out something I didn't expect. In May last year, I participated in, first, does everybody know what open data is? You need to know that to understand this presentation. Let me see some hands. Who knows what open data is? Okay. What's open data, Gates Foundation?
It's the premise of making data that's collected in studies available to a wider population for analysis and collection.
Yeah, that's good. Open data is data sets that are published, often by governments, national, state, city, outside of a firewall, in a catalog, which is like a database, in a downloadable file, for anybody to use, for any purpose, without permission. It's one of the most remarkable revolutions that's happened on the internet and in data management, and it's more remarkable because it came from one of the least innovative places in our world, which is government. It started in 2005 with a World Bank initiative called the Transparent Aid Initiative, which is the idea that if we brought transparency to international aid, we might be able to reduce corruption. If there was some more transparency between donor countries and recipients, we might be able to trace the money before it goes to the Cayman Islands. In 2006, a young senator from Illinois proposed a bill saying, well, if the World Bank can have transparency in international aid, Why can't government? And when he was elected president in 2008, Barack Obama turned to his campaign staff and said, I want my administration to be the most open and transparent administration in history. I want us to find a way of publishing more data about what our government does so the American public doesn't have to send us Freedom of Information Act requests. And that started a domain called data.gov. And data.gov today is the largest open data repository in the world with about 350,000 data sets about everything from NASA satellite pictures to agricultural production. In 2011, the Obama administration started a global initiative to take open data far beyond the United States. It's called the Open Government Partnership. Who's heard of OGP? Wow, nobody's ever heard of OGP? I hadn't heard of it either until last year when somebody at IBM came and asked me, hey Steve, I was doing open data work, could you represent IBM in the Open Government Partnership? And I said, what the heck is that? And they said, it's a group of 65 countries that are collaborating on open government and open data policies, programs, and standards. And I participated in a few calls that the State Department organized, and I thought it sounded like a big academic waste of time. And I really didn't pay attention to it until someone finally came to me and said, we need you to participate on a panel in Dublin in May. And I went. And it was really fascinating. I was at Dublin Castle with lots of other, it was a European regional event for OGP. I met lots of really passionate people in governments across the EU. I met the country of Moldova, which has one of the most remarkable open government programs in the world. And while I was there, I was talking on a panel about open data and what we were doing at IBM around standards and programs to help different governments with open data programs. And a young woman from Sierra Leone stood up and said, we are now just joining the Open Government Partnership. There are 8 countries in Africa that are part of OGP: South Africa, Tanzania, Kenya, Tunisia, Sierra Leone, Liberia, Ghana. And she said, we just joined. We don't have a lot of skill in open data. We don't have a lot of people who understand data management. We don't have any records management. Could IBM help us develop an open data program? I frankly had, at that moment, no really clear idea where Sierra Leone exactly was in the map. And maybe I had just heard about it when she told me she was from Sierra Leone. But I said, sure, okay, maybe we can help you. And so we spoke afterwards, and she gave me her business card. And she said that they were working to build a data school to train people with skills in data management, records retention, because there was no records retention in Sierra Leone at all. The government didn't keep records of what they did. So I went back to the State Department and I asked them, what do I do about this? Are there any public-private partnership programs that would help IBM help Sierra Leone? We went through a whole predictable process of meeting with USAID, and for those private companies in the room who have ever met with the US government, and you hear that word, public-private partnership, do you know what that means? It means the public sector expects the private sector to pay for a program. It's always sort of like 2 people sitting across a table looking at each other, each one expecting the other one to pay. And nothing happens. After the first meeting with USAID and State Department, my friend at State Department told me that President Obama was going to be hosting the first ever US-Africa Leadership Summit in Washington on August 5th. Did any of you attend that? I did. And before I even attended, I went to State Department and I looked at the program that they had, and I asked them, who's going to be talking about open data? Because I bet you that Sierra Leone is not the only African country that wants an open data program but doesn't have the skill or people to run it. I bet you that Liberia and South Africa and others, they would like to have one too. And State Department said, that's a great question. would IBM be willing to host a side event? And I immediately jumped up and said, sure, not knowing what a side event was or exactly what I was jumping up for. I said, sure, we'll do it. And over the next 6 weeks, we organized an Africa Open Data Jam. We're lucky at IBM, we have offices all over the world, and we have an office 2 blocks from the White House that has a great briefing center. And so we, together with State Department, USAID, the White House, and the US Department of Agriculture, we organized an Africa Open Data Jam. We had 120 people participate, in which we talked about different open data programs around the world, how it works, what different countries were doing, what some different cities were doing. And in the midst of the program, well, just before the program, I heard about this thing happening in West Africa called Ebola. I mean, I read about it in the paper, and I kind of asked, is this a topic we ought to have on the agenda? And everyone said, no, it's just a small thing. Nobody has to worry about that. And at the event, we had 20 people from Sierra Leone and 5 from Liberia participate. And at 1 o'clock on August 5th, just as we were wrapping up lunch, all of their cell phones buzzed. You know that SMS buzz? The sound of a cell phone on a table when it vibrates? And they all looked at their phones. And it all had the same message from British Airways, notifying them that their flights back to Freetown and Monrovia were canceled because of this strange outbreak in the far reaches of their country called Ebola. And all of a sudden, a subject that really had, for all of us, felt very remote, became incredibly important. And we basically put aside the rest of the agenda that we had prepared for the rest of the afternoon and did some breakout sessions. You can see one here. This was the African Open Data Jam that we had, and the woman over there is from Sierra Leone. We started to brainstorm together, what could we do with technology to help Sierra Leone and Liberia fight the Ebola outbreak? And frankly, we really were full of great ideas. We had no idea what we were doing. We had lots of ideas. We were fortunate because we had just opened up a research lab in Nairobi, and our team in Nairobi immediately jumped forward with a proposal. I think, Jocelyn, you talked a little bit about the fear in the country. One of the things that President Koroma did on, I'll never forget, July 3rd, just after the Ebola outbreak, was he announced that Ebola was an enemy of the state, which is an interesting thing to announce to your people. 5 minutes. Really? No, come on. Are you kidding me? 15, 5. All right. Anyway, we developed an SMS application to try to help the country of Sierra Leone identify the fear in the country, in the population. We discovered just enormous obstacles. I have to say honestly, Sierra Leone was completely unprepared for Ebola. We encountered cultural challenges in talking about technology with people in their Ministry of Information, their Ministry of Health, their Ministry of Education. We would talk about how to collect data, and they're too polite to tell you they don't understand, so they just would agree with everything that you said, but you get off the phone and you realize that they really didn't understand anything that you said because they had never been schooled in the technology world. And so basic things like setting up a call center to collect SMS messages and taking those messages and putting them out on a VPN and sending them to Nairobi where somebody could do social sentiment analysis and provide a heat map. I could tell you that, and I think there's some people in the room who understood what I said, but there wasn't anybody in Sierra Leone who understood what I was talking about. And then, of course, there's 7 languages in the country. And we had to do translation from 7 languages to English because our people in Nairobi only spoke English. They didn't understand the 7 languages. And then, of course, 70% of the population is illiterate. They can't text because they can't read or write. So they have to call into a call center. And then you have to transcribe what they say. You have to send those messages out. So we had a great idea for a solution, but implementing it in this country proved to be extremely challenging. To find out what people were feeling, how they were reacting to the crisis, we tried to provide a feedback loop. That was the first step. The second step was, as we began working with all the different parties in Washington on the outbreak, we could see that there wasn't a really effective flow of information. There was no central repository for what was happening in these countries. There was no database of information that everybody was taking advantage of. Everybody had their own data, WHO, CDC, Red Cross, World Bank, and all of them were running at breakneck speeds to figure out what they could do. And each one of them bringing what they know how to do. I mean, in a crisis, you can see it so clearly. Everyone comes to the table with what they want to give. Nobody asks, what do you need? What's already working? How can we help you? It's really, you know, what can we give that we want to give? I often tell the story when President Sirleaf Johnson came to Washington to beg President Obama for help, he sent Marines, which you talked about. And the Marines, of course, were sent because there were a lot of people in Washington that were terrified that Ebola would totally destabilize Liberia and Sierra Leone and plunge them back into civil war. And the Marines, what do? They built Ebola treatment units, these ETUs. Do you know how many they built? 3,000. We built 3,000 Ebola treatment units in Liberia. Do you know how many patients we treated? 28. 28. How many billions of dollars we put into building these 3,000 Ebola treatment units? We treated 28 patients. You know why? Because by the time we allocated the money and we sent the troops over and we provided them with the material and they built the Ebola treatment units, Liberia had its act together, they had great governance, and they already figured out with the existing resources they had how to contain the virus. So by the time the ETUs were ready to go, there was nobody left to treat. Because when there's a crisis, we show up with what we want to give you, not what you need. That's what I learned working in the Ebola outbreak. So we tried to figure out what could we give that the country needed, and what we could clearly see that they needed was information. So I organized an Ebola Open Data Jam in New York with a bunch of Liberian and Sierra Leonean expats living in the Bronx and in Manhattan, Long Island. They all came into New York City, and we scoured the internet for available public sources of information about the Ebola outbreak to put it into one place where any aid agency could find it. We found hundreds of different data sources. It was really fascinating. The one thing we did find in searching through all this data was how little data there was about the capacity of healthcare in the country. And we talked about this before. You can't find anywhere a database that tells you where all of the hospitals and treatment clinics are in these countries. There is a list. Somebody has it. The World Bank and Red Cross, they built lists. It's on paper. It's not on the internet. If you ask for it, the Ministry of Health will give it to you. They'll fax it to you. Or they'll print it out and they'll mail it to you. But it's only a list of the addresses and the names. It doesn't tell you the year the facility was built. It doesn't tell you how many beds it has. It doesn't tell you how many doctors, what the training of the doctors are, how many nurses, if they have electricity, if they're connected to paved roads, if they have a helipad, if they have internet, if they have sanitation, and you can be sure none of them have IV. Think about it. You're treating a disease which dehydrates people. That's how you die from Ebola. You get dehydrated. You get dehydrated, and nobody in West Africa had IV. They treated these people just with water. And that's why we began working on building a comprehensive data model to collect that resource. Because we knew we had the skill and we had the talent and we had the people, and so we invested time in building a comprehensive data model to capture a detailed inventory of healthcare capacity. And as we began to do that, we began to work with lots of different people in CDC and WHO and all these different organizations. And we realized not only did we need to create an inventory of healthcare capacity, but how about an inventory of education capacity, of infrastructure, of electricity? This type of data doesn't exist in many countries in Africa. Nobody's taken time to document it. And that's it has a huge hindrance on development. It's really hard if you're a development organization to know what to fix if there isn't any information that tells you what's broken. So we began working on that, and along the way we organized an Africa Open Data Group, which now has about 600 members. And I think it's the largest open data group that's focusing on Africa in the world. It's kind of weird. I don't live in Africa, and as many of you can see, I've been to Africa maybe 10 or 20 times, but I'm now the proud owner of the largest Africa Open Data Group. We've had, we meet on the phone every month. We had another Open Data Jam in February, and we're soon organizing the first Africa Open Data Conference in Dar es Salaam in Tanzania on September 1st to September 4th. And there's a blank chart. What happened to my charts? Oh, well, the rest of it just tells you, the great thing about a blank chart is you can fill it in with anything you want. I'm just going to, I think I'm past my 5 minutes, so I'm just going to summarize some of the things that we're doing at IBM. We have offices in 24 countries in Africa. We have research labs in Johannesburg and in Nairobi. We just yesterday announced an initiative in which we're investing $60 million across the continent in 80 different universities to improve skill in IT. Because as we learned in Sierra Leone, it's really hard to react to a crisis if you don't have the skill to handle the issues that come before you. And so rather than wait for the next crisis, we're trying to invest now in skills development across the continent to build the capacity to start to document the inventory of infrastructure, of critical infrastructure, of healthcare, of roads, of transportation, of education that is so essential for all forms of development and aid. I've heard some really great ideas from the Gates Foundation, especially. Bill Gates had a great article about how to prepare for the next Ebola crisis. You know, we were so lucky with Ebola that Ebola is not airborne, and that it only infected 20 or 30,000 people. But with climate change and with warming temperatures around the world, what if the next Ebola crisis transmits like H1N1, like SARS? What if we have the next Ebola crisis is airborne? What if the disease mutates? How on earth are we going to be prepared for that? From an IT point of view, I would urge all of you to start talking about how we inventory capacity in our countries and publish this information online in open data so that organizations like Gates and IBM and all the rest of us can take advantage of that information to know what you have that's working, that we can come in and augment and help fix so that the next crisis that comes along, we all know what needs to be done the minute it breaks. I had more, but you don't want to hear more. You guys are giving me that look. Is he done yet? Yes. Thank you very much for your time.
I'm sure we'll be allowed to entertain a few questions. May I see at least 3 hands? Any hand? Do I see? Okay,
Yeah.
Over there. Okay, one over there. Okay then.
Thanks, Steve. It's really great. Just a point of correction, because I'll be killed if I don't just correct this part, which is that, it's not 3,000 units, because it was one in each, just one in each county, but they were thinking about 3,000 beds, and no matter how we said we don't need that much, they kept saying, this train's already out of the station. You know, so yeah, it was a lot of excess capacity than we needed, for sure. Thanks.
This was very, very interesting, very good. The question I have is, how much effort goes into this kind of initiative? Because you've been talking about open data, but can it be applied to other fields? For example, we're talking early childhood development. What would it take to create the same depository or database for other areas, or whether in what you're doing you're already looking at, other areas?
Yeah, there's actually a really great World Bank story about a project they did in Burkina Faso where they captured its education data about childhood development. And I think there's a great YouTube video or Vimeo video. I'm happy to provide the link to people. It's a really great use case of how They're capturing data about children's performance in school, anonymizing it to protect the privacy of the children, but then comparing children's performance within a school, within a grade, between schools, both in a community, in a county, and wider, and then sharing that information with the parents to let the parents understand how their children are progressing. And they cross-reference that information with healthcare and other types of data, and it really provides parents with an invaluable insight into how their children are growing and how their growth compares to their peers, and what types of maybe home interventions could be applied to help their children perform more effectively. And I think that's we're seeing some of those types of initiatives start to grow across Africa. Tuwaweza wants to do something similar in Tanzania. And I think those types of initiatives really can add a lot of value. I was really encouraged by what I saw that Colombia is doing, for example. I thought that was a fantastic story. And I think those kinds of data initiatives, it looks like a lot of work, I think, but the great thing about my experience in the Africa Open Data field was we were able to take advantage of a huge amount of skilled resource. And a lot of countries in Africa have vast diaspora communities in the United States who are really interested in engaging, who want to help their countries grow, and are willing to spend time on weekends and during the week at data jams and hackathons and other forums to help provide and collect information to share their own insights and their own experiences in their own country and help develop applications and data repositories to grow. So I think it looks like a lot of work on the outside, but it's really not. You can do a huge amount with very little today.
Okay. Any more questions,
Yeah.
perhaps? Yes, here.
Thank you. My question is, you've made a very persuasive case, I think because it is strikingly clear how useful it would be to have this kind of informational flow of data available. I wonder if you could comment on how you get from a communication system and data flow to coordinated response. And, this is one aspect of coordinated response, is having data available to people. But, I think the whole world of disaster response is trying to figure out how do you plan for emergency response so that the response is thought through in advance to be coordinated. Because you're describing a lot of struggles with coordinating responses. And I just think, from your experience, you might have some reflections about that, because I think people take lessons learned from a specific case of Ebola. Certainly in the US, they took a lot of lessons learned from Katrina and changed some of their response systems. But coordinating the actions of people in interacting systems is challenging.
Yes, it's very challenging. I have a lot of different perspectives on that. We encountered a huge amount of obstacles not so much in New York, among people who were doing hackathons and data jams on a regular basis and knew what to do. So they would show up and we would say, here's a data model, here's where the data is, help us fill it out. We had more challenges in country, communication, language. We had challenges with aid organizations. A lot of aid organizations didn't have accurate data themselves. A lot of US government organizations didn't have accurate data. It was interesting, the UN Global Compact, have you heard of that? UN Global Compact? It's an organization that the UN put together of 850 different private sector firms. And during the Ebola crisis, they created an emergency Ebola response group, a contact group of private sector firms that wanted to help. Many of them, I participated in a few of these meetings, many of them were extractive firms whose operations had been impeded by the outbreak and they wanted to see the outbreak go away so they could rush back in and pull out the iron ore or wherever. What we discovered with working with them is that a lot of private sector firms have a lot of great data because they have operations in these countries and they need to know, thank you, well, where can I send my people if they get sick? Where should I send their children to go to school? How will they get around? How will they travel? What roads are available? What communities have electricity? Where's internet penetration? And so it turns out the private sector has a lot of really valuable data that the private sector would contribute as open data. It's just nobody ever asked them. And we discovered lots of private sector firms were really eager to give up their data. There are license issues that they have to go through. They have to go consult legal counsel and get approval. And there's a learning curve about open data in the private sector. But when you actually start engaging people on the subject, you discover there's a lot of data. It's never been put together in one place. And I think we in the West, if we really want to help Africa, I think we have to coordinate ourselves better. We have to reach out to private sector, to public sector, to NGOs, and we have the skill and talent that they lack. And the great thing about open data for African friends is if we collect it and we make it available, we're not doing data colonialism. Because when it's open, it means you can use it too. You don't need our permission to go and download it and put it up on your open data portal in your country. So if we go off and we collect information about Liberia or Sierra Leone or Ghana or Ethiopia, it's open. Everybody can use it. So where we have the skill, we ought to help them. I really believe we have to take the step to try to collect all the data that we've been collecting about these countries for decades and have never shared in open formats, and let them have it. That would be a great contribution from us.
Leonard Chuma from International Child Resource. Thank you very much. This is really innovative, and I think we've been looking forward to this. Unfortunately, it has already been with us. So thank you for that. I noticed that the government of Kenya agreed to come into open data government in August 2011.
That's right.
That's already several years ago. I was interested, what kind of information is the Kenya government sharing on this platform? And then secondly, your examples are motivation that have been pushed by crisis.
Yes.
For people to ask what to give or what to share. I think my question is, what can we do? And maybe not really your question, but self-assessment. What can we do when there are no crises to be motivated to share as much as possible?
Yeah, those are good questions. The interesting thing about the Open Government Partnership is it isn't just a soft diplomacy forum where people meet. There's actually a kind of rigorous compliance schedule for countries that participate. They have to agree to national action plans. And these plans require them to commit themselves to open budgeting, Freedom of Information Act requests, engagement with civil society. There's 32 different areas of commitment that governments have to make. In the United States, we're now doing our third national action plan. Kenya is in its second. In Kenya's first national action plan, they published an open data portal funded by the World Bank. It's up there, you can find it. It's going to be relaunched in August. And I'm actually traveling to Nairobi tomorrow to work with the Open Data Group in Kenya to help them relaunch their portal. I think I can answer your second question by continuing to talk about Kenya. For a lot of governments, open data is a supply of information that's being published out. And they're looking for more demand from civil society and the private sector. And what we do in IBM is we engage a lot of governments to talk to them about how open data can be used to stimulate economic growth and jobs and private sector demand. We talk to them about how they should be consulting with the private sector to understand what types of information could private sector organizations use that the government could publish as open data, like train and transportation schedules, like description of inventory and roads, like tourism data, like census data, better statistical information, agricultural production data, industrial production, extractive contracts. If you think about it, a lot of that information can really stimulate economic growth because it can help inform organizations on how to make better decisions on where they should invest, where they should open offices, who they should work with. And I think that's the next phase of open data, is where we start working more in collaboration with civil society and NGOs and private sector organizations to figure out how this information can really stimulate jobs, revenue, and growth. And that'll be good for children too. I'm told I have to stop now.
Okay.
Thank you for your time.
Thank you very much, Steve. Now I leave the floor to Professor Ta.